Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappeared.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella, diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing!
Yung sister ko had the symptoms of diabetes. Siguro 10 years na. Madalas siyang umiihi, tapos laging pagod, pumayat, mataas ang BP. Tapos siyempre, mga non-healing wound.
Yung sa paa po ni ma'am, paano po yun nag-start?
Okay. Kasi ganito yun eh. Yung first na hospital niya, not because of diabetes. Ang una niya, pneumonia. Ayan. Doon nalaman na may diabetes din siya, by accident. Right foot niya, may para siyang matang isda lang. Yung maliit na itim lang. Tapos napapaligiran lang siya ng parang dilaw na kulay na dilaw. Ring sa sugat na yun sa center. Tapos tinanong ko, bakit? Hindi niya daw alam anong reason. So sigurado ko dahil nga may background ako sa medical, siguro dahil yun ay lumala na yung taas ng sugar niya, hindi niya na monitor, hindi niya nabibigyan ng gamot, nagkaroon siguro siya ng komplikasyon. Yung nerve sa paa na damage na, So, hindi niya na nararamdaman na may natapakan pala siya. So, probably, yun siguro yung nangyari. May natapakan siya, nasugat yung paa niya, maliit lang, tapos hindi niya naramdaman. Lumala. So, nagkaroon siya ng lagnat on and off, nakahiga lang siya. So, sabi ko sa kanya, so anong plano mo? Sabi ko, pa-check na natin yan. So, pina-check namin as OPD. Chinek, binigyan, niresetahan ng gamot. Tapos, tinignan yung sugat, binusbos. Pero kapiranggot lang ang tinignan. Tapos, in-advise na lang kami, linis, at 7 days na gamutan ng antibiotic. After ng 7 days, lumala lalo. Yung pinaka-pamamaga niya, lumaki lalo. So, sabi ko, ay, na-infect na to. Nilala ko sa emergency room. Ayun, doon nalaman lahat. Mababa pala hemoglobin, mataas masyado yung sugar, yung diabetes niya, talagang marami ng komplikasyon.
Ano po yung plans ng doktor niya?
Na-refer siya sa ortho. Ang plano sa kanya ay putulin. VKA or the below the knee amputation. Hesitant din kami pumirma ng consent. Then later on, ni-refer naman siya sa plastic surgeon. Nagsabi naman sa amin na maganda pa circulation. Might as well na tulungan na lang natin yung paa, linisin, wound dressing for twice a day, then debridement as needed, religiously. So, yun ginawa namin. Twice a day kami naglilinis, tulungan kami ng husband niya, hanggang ang nangyari, gumanda, pero andun pa rin yung plan na putulin. Hanggang makita na gumaganda na, ayun, hindi na naulit yung plan nila na maputol yung paa.
Kasabay po ba nun may mga tinitake pa siyang gamot?
Bukod doon sa antibiotics, bukod sa mga gamot na binigay ng doktor sa ospital, may tinake din siya na alternative medicine, yung PPARS. May kamahalan. So, sinugal ko para, kasi kailangan kung di mo isusugal yun, baka maputulan talaga. Kasi kahit naglilinis kami ng paa, tapos nagdidibri, pero parang slow yung healing process niya. So, I tried na painumin siya at 10 tablets at AM and 10 at lunch and then 10 at the evening. And the soft gel, twice a day also. So, religiously binibigay ko yun sa kanya. Ang dati kasi dahil nag-peak yung WBC niya, medyo nag-septic siya. Sa mga nakakaalam, sabihin yung infection kumalat na sa buong katawan. Kaya nagkaroon ng problema yung kaisipan na nawala sa wisyo. Dramatically, yun yung maganda doon. Dramatically, after 1 to 2 days, parang nakita ko siya ng improvement. Doon, nakita namin na sa help ng antibiotic and together with PPARS, sabi ko, maganda yung kinalabasan. So, why not continue? Hanggang nakita ko rin na gumaganda yung healing process. Tapos yung WBC, nag-dramatically from 46. Imagine, 46, dramatically bumaba siya ng 39, 33, 27, 19, 15, and then 11, 9, 7. So, nakikita mo talaga yung changes na nagawa ng gamot na yun. So, yung support ng family ay mahalaga sa recover ng pasyente. So, una, yun yung talaga nakikita ko, yung support system. Then, secondly, syempre, with the help of the advanced technology, like yung mga ini-introduce ng mga gamot, hindi ko pwedeng alisin yun sa scene, sa scenario. So, ako kasi, dahil nga nasa medical field ako, medyo alam ko yung mga ganyang mga alternative medicine and evidence-based ako. So, sa PPARS, sabi ko nga, maganda yung result. Ito walang harong biro to. It's not joke. Yung man ako binayaran So, it's no joke. Talagang maganda yung yung nangyari sa kapatid ko, lalo na yung wound healing. Yun yung nakikita ko, yung wound healing talaga. Nag-granulite siya, gumanda yung circulation, nabuo ng laman, okay? Nagkalaman yung mga paa niya, na dating wala. Makikita niyo naman sa picture, di ba? dating wala, nagkaroon ng laman. So, na-prevent natin yung pagputol. I can say na effective. Okay, effective yung PPARS.
Ano yung ma-advise nyo sa mga patients na same case sa sister ninyo?
Okay. So, I advise them to try. Then, kagaya ko, gusto ko may ebidensya na experience ng on hand ng ate ko. So, ganun din yung papayo ko. Try to experience yung healing, try to take the medicine religiously ha. Despite medyo may konting kamahalan, but then kung titingnan mo naman yung long term na gamutan, mas mahal yun. Tsaka hospitalization. At yung syempre, yung recovery. Yun yung maganda doon eh. Yung recovery, mapabilis. So, try ninyo. Hello, I'm Joel Elcano. My sister, diabetic since way back 10 years up to now. Because of Simply Nature, hindi niya na kailangan mag-amputate. Yung recovery niya, yung unti-unti, nagkaroon ng maganda, nagkalaman yung kanyang mga paa. Still recovering, yet nakikita ko yung magandang bunga. And that is because of Simply Nature, PPARS. And I trust Simply Nature.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Ako si Haji Norma Yusuf, taga Zamboanga City. Pero dito na ako nakatira sa Maynila. 13 pieces na bukol, pero yung mga iba maliit siya. Pero yung itong isa malaki siya, parang umabot na ata ng 3. Kaya nga ito sabi ng doktor, kailangan tanggalin na. May kaibigan ako, i-try ko daw itong yung PPARS. Pangalawang gabi, may naramdaman ako parang iba. Yung parang may langgam na parang gumagalaw ganyan hanggang dito, hanggang sa talampakan, ganon. Pangatlong araw ko. Parang kung sumakit yung dito ko, parang gusto ko talaga. Pag ko ganyan sa CR, yun parang lumabas talaga na ganyan, napakarami talaga. Siguro sunod-sunod yun, 3 araw, ganun. Tapos sabi ko, pagtapos yung dito ko, minsan yung parang, ganun-ganun ako. Parang masikip dito, parang minsan sumasakit dito ko, ganyan. Yung na ako dito, umabot na ng mga 5 days, ganyan. Parang nawala yung sakit dito, nawala siya. Parang hindi na ako ganon. Pag nagsalita ako, parang tuloy-tuloy na, wala na akong halos maramdaman. Kaya siguro, hindi ako, sabi ko, parang ayaw ko magpa-opera, siguro mayroon talagang gamot para dito. Binigay ng God. Ngayon, hanggang ngayon, parang maganda ang maganda ang pakiramdam ko. Yung high blood ko, pag parang magandang tinanggal ko na yung sa cholesterol ko, hindi na ako, pero yung sa cholesterol ko, pag tinatanggal ko yon, parang hindi, mga 2 araw, parang masama ang pakiramdam ko. Pero ito, 14 days na, ngayon 14 days na, basta 2 weeks na, hindi ako uminom ng subastatin, wala akong nararamdaman na parang maganda ang Kaya yun, ngayon bumili pa ako ulit ng tablet. Oo. Kasi sabi ko para para lumakas talaga sa akin ng Kasi nararamdaman ko talaga na maganda. Ay, Norma Yusuf, ay bukol ako dito sa liig ko, 13 piraso. Umabot na ng 3 cm. Take ako ng PPARS 2 times, morning at saka gabi. Pag numulok ako, hindi ko na siya mararamdaman. At saka kinakapa ko siya, parang nawawala, parang wala na, hindi ko mahawakan. Hindi katulad ng dati. Salamat, Simply Nature.
everyone, my name is Sheila and welcome to another episode of Simply Nature webinar. This program is brought to you by Simply Nature International and Simply Healed Medical Group. Just to recap on our last week's topic, last episode we discussed hypertension and diabetes link. Lots of questions were asked and most importantly, answered by our experts. And this week, discover how cancer and metabolic illness patients can benefit from using PPARS because tonight's interesting topic is entitled Facts and Solutions for Cervical Cancer. Today, we'll cover key information including risk factors, prevention strategies, and the latest advances in screening and treatment options. With early detection and regular screenings, the impact of cervical cancer can be significantly reduced, helping to save lives. We'll also discuss lifestyle factors and practices that can. We extend our sincere gratitude to each and every one of you for tuning into this webinar, and we encourage you to share this online event to your friends and loved ones who may benefit from the insights shared here tonight. Without further ado, let's dive right in. Please note that we will be having a what we call AMA or Ask Me Anything portion later on. So please feel free to drop your questions on the comment section. And yes, kahit Tagalog, pwede po. Leading our discussions tonight are distinguished health experts. First up, I'd like to introduce a successful entrepreneur and seasoned international speaker on a wide range of topics from personal success to healthcare. He is the CEO and founding director of Simply Nature International. Our Simply Nature International, Mr. Shyan Lim. Hi, Sir Shyan. Good evening.
Good evening, Sheila, and good evening to all our audience tonight. Tonight we're going to talk about cervical cancer, and it's going to be just very quick discussion, and we'll go straight into our Ask Me Anything segment. We have Dr. Jansen with us for both the discussion and the Ask Me Anything segment. So looking forward to see you guys in a few minutes where we'll answer all your questions live. So I'll hand the time back to Sheila. Thank you, Sheila.
Thank you, Sir Shyan. And now on to our next health expert. It's an honor to present our esteemed speaker, Dr. Jansen a distinguished graduate of St. Luke's College of Medicine. Dr. Kalalan is a diplomate of International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Kalalan. Hear from the experts. Let's all watch this.
Hello everyone. Tonight we're going to talk about a very problematic cancer, which is cervical cancer. So what is cervical cancer? So cervical cancer is basically a tumor that is growing in the cervix. What is the cervix? Sa Tagalog, ito yung kwelyo ng matres. So translating this in English, this is the collar of your uterus. This is a donut-shaped structure located at the end of the vaginal canal that forms the boundary between the vagina and the uterus. So that is your cervix. So what causes cervical cancer? The most common cause of cervical cancer is actually a virus named human papilloma virus. How do we acquire this virus? How is this virus transmitted? This virus is transmitted mainly through sexual intercourse. So for cervical cancer patients, the number one risk factor would be multiple sexual partners, early age of coitarch, no? Or a very early age wherein you had your first sexual encounter is also a risk factor. How common is cervical cancer in the Philippines? It's actually one of the top 10 cancers diagnosed here in the Philippines. Can cervical cancer be prevented? Yes. How do we prevent cervical cancer? Is by way of vaccinating using Cervarix, Gardasil, and Gardasil 9 or Gardasil Nano. These vaccines is a 3-dose series, no? And you can actually start vaccinating at age 9 up until age 45, no? The role of vaccine here is very important because these vaccines are quite cheap when compared to the cost that you would spend, no, once you actually develop cervical cancer. Another way to prevent cervical cancer is just to have one sexual partner throughout your life.
sure that you have learned so much from that discussion by Dr. Jansen Kalalan. We are now in the what we call AMA or Ask Me Anything portion. All right, so let's dive right in as well. And let's not keep you waiting. I can see questions are coming in. And know that in this modern world filled with noise of different health opinions, trust the ones from the experts. To answer your questions for tonight, I'd like to call on once again our health experts, Mr. Shyan Lim and Dr. Jansen Kalalan. Good evening, Sir Shyan. Good evening, Dr. Jansen.
Good evening, Sheila. Good evening, Doc. That was a very short discussion. Yeah, but I think let's go into the AMA, which is what everybody wants and enjoys also. So, Sheila?
All right. Okay. Well, actually, this question was thrown to us last week, and I'd like to ask this question tonight also. Okay. So, for the first question coming from Ms. Teresa Holinganga. Hi, I'm going to have chemotherapy using paclitaxel and carboplatin. Can I drink PPARS together with chemotherapy, and can PPAR interact with chemotherapy effectively or vice versa?
Yeah, you can actually, no. But here's how I would schedule it. Don't take PPARS just before the chemo. Okay? It would be better if you take PPARS after, or at least 24 hours after. The reason being, the chemotherapy exerts oxidative stress onto your body to kill the cancer. So PPARS has very strong antioxidant properties. So if you take the PPARS first, then receive the chemotherapy will eradicate the antioxidants from the PPARS. Okay? So what I would do is take it 24 hours after. This is also so that your onco, if there are untowards reactions, no, your onco will not blame PPARS, no, which led to the reaction. Okay. So, however, if you just look into the science, will it be okay if you take it really take it together? It is fine because the mechanism of action of those two chemotherapy medication on how it exerts damage to cancer cells and how PPARs protect you, no? They're quite different. The mechanism is different. Okay. So you might think that, hey, if I take PPARS, it protects my bone marrow. Will it protect the cancer cells as well? No, it doesn't. It will not protect the cancer cells. So the chemotherapy will still exert its normal effect, its usual effect on the cancer cells to killing them. So the PPARS will just protect the healthy cells. Okay, if you look at the mechanism. Okay, so but my recommendation in real world scenario, I would still space them out. Okay? Yeah, I would still space them out because of how doctors would react to it, how your doctors would react to it, okay? But yeah, I am not an onco, so I don't give chemotherapy, but if I am an onco and I learn of this, I would allow my patients to take PPARs, then at the same time have them receive the chemo. Okay? Yeah.
Thank you. Very encouraging. Sir Sean, would you like to add anything?
No, I'm good with what Doc has said. I think it's as Doc said, there is no issue taking it together, but the best would still be to space it out. That means not take it before and after, not together with the chemotherapy at the same time. Yeah.
Thank you. Thank you, Doc. It answered actually the most common fear of all the patients who are about to undergo chemotherapy, right?
Yeah.
Okay. Very encouraging.
Okay, here's something that
Mhm.
all you patients should know. The PPARS, if you by mistake take it together with the chemo, it will not harm your body. If you're worried about negative side effects, no, it will not harm your body. The interaction between these, if ever there will be interactions, would just be the oxidative stress and the antioxidants. That's it. You'll just the chemo will just eradicate the antioxidants of the PPARS. That's it. You will not feel any untowards reaction. If you do get side effects of the usual side effects of the chemotherapy, diarrhea, or abdominal pain, vomiting, no, you blame the chemo. It's the usual effects of the chemo, not because you took PPARS together with the chemo. Okay? Yeah, because there are also patients who do get a softer stool consistency when they take PPARS. So you might think, hey, it might be the case, no? But no, I at least me personally, I haven't seen this kind of interaction when patients undergoing chemo, then they're taking PPARS. Now, here's something I should I think it would be worth trying. You have your schedule for with the chemotherapy, right? You might want to try taking PPARS a week prior to the chemo. A week prior. Prior to the first cycle. It might give you a little protection, a little boost in strength, some degree of protection before chemotherapy is given. But of course, with those patients who are already on their I mean, you're in the middle of the treatment, the chemo treatment. I mean, yeah, you taking PPARS, spacing it out, it's gonna be the same, no? But it's something that you might want to try. Yeah. So say for example, your chemotherapy is scheduled for the next month, 4 weeks from now, then you might want to start early, sort of to give your immune system a little bit of a jump start. Yeah.
Yeah, thank you. Thank you so much, Claire.
I think
Yes,
that's a
Susan.
very interesting suggestion actually, because the basic idea is to strengthen yourself as much as you can, right, Doc? Before you actually go into something that will tax your body, right? It's important and it's part of your treatment, which is chemotherapy, but it will tax your body. So you get it as strong as possible, and this would probably allow you to go through your first few sessions of chemotherapy with very little discomfort or minimal discomfort, because you go in as strong as you can be. Yeah.
Excellent. Thank you. Thank you so much, Sir Shyan and Dr. Jansen. Next question, thrown to us privately by Miss Amy of Quezon City. What's the pre-diabetic protocol in taking PPARS to control to be full-blown diabetes?
It's the same, no? If you are diabetic, full-blown diabetic or pre-diabetes, it's the same. It's tablets and a soft gel. Yeah. I actually have I should share this. I should share
Oh,
this
come
with
on, come on.
everyone.
Yeah.
I actually have a patient. I just saw him earlier this week, no? I gave him PPARS and a few supplements from Pure Encapsulations. Gave it to him for 3 months. The previous HbA1c was 8.4%. 8.4. So it's quite high. It's uncontrolled diabetes, basically. His fasting blood sugar was, I think it was 250 plus. So it's really crazy high. So after 3 months, so I asked him, okay, so what did you do in terms of lifestyle? He said, yeah, I did a little bit of dieting, but it's still practically the same, ate practically the same food. But what he removed was the processed foods. He stopped snacking, did a little bit of light exercises. By light, no, it means like household chores. So cleaning up cleaning up around the house, washing the car. So this intensity of physical activity. So this week he had his repeat blood works. HbA1c is at 6.4%. This is without medication. No
Wow.
medication at all.
Wow.
So I mean, yeah, it really does work. So
That's very enlightening and
So,
encouraging.
hold on. Please carry on, because I'll look for pictures. I hope Junie will be able let me on with the next question. I'll look for something I want to show everyone. Yeah.
Okay, thank you. Well, as you know, of course, I've mentioned that you can ask everything under the sun. Ask me anything. Yeah. So the next question coming from Ms. Luz Minda she has breast cancer. My naturopathic doctor told me about PPARS. Is the vials the best form for cancer condition?
yes, it should be the liquid. It should be the vials. Right now, well, I'll just tell you a little bit of my story on how I started with Simply Nature. So, of course, initially when I first encountered Simply Nature, there was a little bit of skepticism, quite of a reluctance in prescribing, no? Well, one reason was because of the price. Another one is, of course, I mean, efficacy-wise, right? So, well, through experience, through the amount of patients that Simply Nature was referring to me and me personally, encountering all the other patients that I was meeting, no, outside of Simply Nature, I started to experiment with different protocols, see how patients respond. And I should say the liquid is really the way to go for cancer in all stages. I mean, stage one up until you are in an advanced stage already. I don't usually go outside the standard dosing that Simply Nature recommends. So it's a vial every day. A vial every day does a lot actually. It does wonders to patients, no? However, it will not be it won't be realistic of me to say that everybody benefits. Of course, there will be a little bit of patients who really doesn't respond, no? Or who has adverse reactions for whatever reason, for whatever reason. By adverse reaction, they get surprised because of the taste. I mean, yeah, there are some of those occasions, but in general, I should say 90 to 95% of my patients do benefit from the liquid, much more than the other Simply Nature PPAR products. I mean, I'm just one doctor of Simply Nature. Simply Nature has a lot of doctors, other doctors. I mean, I don't know what the other doctors' experiences are, but this is me, this is me on what I see. It might be different from how the other doctors their experiences, but it's really the liquid that makes the biggest impact. So from then on, my first prescription is always liquid, regardless. I mean, right off the bat. I mean, when the patient comes, I take a look at the case. If I see that Simply Nature PPARS would be very helpful for the patient, it's immediately the liquid first. Yeah. Then I just tell the patient, okay, here's the prescription, here's the protocol, this is the benefit. Take it home, talk it out with your family, your friends, whoever. Then if you have any if you want it changed, then please do tell me so I can modify, so we can meet somewhere, somewhere more realistically financially. So that's how I operate already right now. So yeah, so it's really the liquid.
Yeah, Doc, I just want to let you know, that is actually among all our top doctors who use PPARS to treat patients, even for other things apart from cancer. I mean, Doc Jaime is one of them. And yeah, the liquid is really something that is the best. And really, one super positive thing about the liquid is you can feel the effects fast. Usually within 48 hours, you feel stronger. I'm not saying that the cancer disappears or the tumor disappears, but definitely the patient can feel the effects of the liquid very quickly. And it's kind of strange that sometimes, in the beginning, like Doc also, it's the financial part that we worry too much for the patients. But, I've actually stood outside oncologist clinics, and I can hear patients talking to their families, and they're talking about 500,000, 1 million pesos, so actually Simply Nature people, even the liquid is actually very, very affordable compared to the other options in cancer treatment. Okay, we were talking about diabetes just now, right? So I would like to share this on screen. Okay, can you guys see that? Can everybody see that?
Yes, we can see.
Yeah, Doc,
wow.
this is the patient.
Amazing.
Amazing, right? This is
amazing.
Truly.
The foot has to be amputated already, but so this person is the sister of a nurse. in Bataan.
Yes,
As
yes.
a male nurse, and his video is actually up on our YouTube channel. So during COVID, he took our PPAR tablets and he recovered very quickly from his COVID infection, right? So he had already experienced our product, and then this is his sister. So apparently the sister's foot had to be amputated. Amputated.
Yes.
You can look at the first picture. Very difficult to watch.
In one word, grabe.
Doc, this was 15 days.
Wow, amazing, amazing. Yeah,
Yeah.
I think if I remember correctly, I think I saw the patient as well.
15
But by
days.
the time that I saw him, I mean, he was already doing good. I mean,
Yeah.
there was only so much that I added. But yeah, really amazing result from something,
Amazing.
you know, a
You had to
muscle
lose your foot, right?
yeah, up to wow, what's that? It's almost regular
Almost
skin
okay
already.
already. Yeah.
Nice.
So, and the protocol for this patient is just not even the extract powder. It's just the soft gel capsule, one capsule 2 times a day plus the soft Simply Nature PPAR micro tablets. That's
Wow.
all the patient was on. So everyone who's watching right now, I just want to make a plea to you. Everybody in our company was very moved by this because everybody realized we saved someone's foot. I mean, we saved someone's foot, right? So if you know anyone of diabetes that's foot is getting gangrene, the doctor said that the foot had to be decided to be cut off like within like less than 4 days. That means the doctor say, yeah, please decide now, because if we don't cut it out, it will go up the foot, right? And it will go up to your knees and things like that. Then your amputation will be more in that. And of course, there will always be the danger of infection for the patient that could lead to death. So that's why. But yeah, we were able to save that. So for everyone, if you know anyone who has gangrene because of diabetes and they're gonna lose their foot, guess what? For less than, honestly, to change this was less than 10,000 pesos. This is crazy. With less than 10,000 pesos, that means it's cheaper than going to the hospital and chopping off your foot. You can actually save the foot. So to all the viewers out there, please, 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 all right, share the good news. This is not the first time that we did it. That's why we were also confident, because because the patient had to decide whether to amputate or not. So thank goodness. Yeah. Now back to the questions. But amazing,
Amazing.
right, Doc? Amazing. I mean, it's always good to know all these things in case someone in our own family, friends and family, that don't have to go to such an extreme solution as amputation. Yeah. Thank you, Sheila.
Thank you. Thank you, Sir Sean, for sharing that one. Thank you, Sir Dr. Jansen. Now, next question coming from Ms. Sofia Bustamante. Will PPARS interact with hormonal therapies for cervical cancer?
Will hormone therapy interact with PPARS? No. Mechanism of action is different. You can take them both together even at the same time. It's fine. But well, I would still space them out. I mean, just to make sure there will be no physical interaction between the two. But chemically, biologically, it won't have any.
Excellent. Okay. All right. So next question coming from Ms. Shamita from Malaysia. How do we know a person have hypertension?
Blood pressure up. Measure your blood pressure. Yeah, because people who are hypertensive sometimes don't feel anything at all. Yeah, so go and measure your blood pressure. Yeah, it's as simple as that.
Doc, just a quick follow-up question. When is the best time of the day that we should check our blood pressure?
There's no best time really, but I should say there is a best state of the state of the body, no? So how you measure your blood pressure, you should be at rest, at least 15 minutes at rest. Then your arm should be at the level of your heart. It should not be like this, it should not be lower like this, it should be level of your heart. Then just relax, no? Then take a measurement. So that's it. If in case you are using a digital blood pressure apparatus, make sure you get 3 measurements, then take the average of those 3 measurements. Between the 3 measurements, there should be 1 minute of rest in between. Okay, so that would give you a little more accurate blood pressure reading.
Well, that's very helpful, Doc. Right. Thank you. Thank you. Doc, Sir Sean, would you like to add anything? Shall we go to the next question?
Yep.
Okay. All right. Next question coming from Miss Valerie Crisostomo. I'm already taking mistletoe extract. Can I try this with PPARS? Mistletoe extract.
I don't think there will be any negative interaction between those two. But by the way, mistletoe extract is it's mistletoe. Okay, it's mistletoe, and the application for cancer is that it induces hyperthermia. It is a hyperthermic therapy, so it increases your core body temperature. It boosts your immune system. So I should say that they even work synergistically. However, since there are no studies or literature that shows how the interactions between these two substances are, no, I would space them out. I would take them separately, not together at the same time. Okay? Yeah, so yeah, it's just because of the unknown.
Yeah.
All right. But of course, in terms of efficacy, I think in terms of the mechanism of action of both, they should work well together.
Excellent. Okay. Thank you, Doc Jansen. Okay. Next question coming from Miss Maricar Tevis. I found out that I have rectal new growth stage 3, but I'm scared of surgery. Can I try cleansing plus?
I am not sure what you want, what outcome you want from cleansing plus. But if you are saying that can you avoid surgery by taking cleansing plus, I'm not too sure. My take on this is cleansing plus alone will not be enough. Okay, because the tumor is stage 3. It means it has a spread already in your lymph nodes, the lymph nodes inside your abdomen. So if you are my patient, how would I manage your case? I would give you still adequate amounts of fiber. I would increase your immune system, and so that's the terrain part, no? I would starve the cancer of fuel, so I would use medications, repurpose them, some supplements, repurpose them to starve the cancer of sugar, glutamine and cholesterol. And I would give you something to actively kill the cancer, to sort of a substitute for the chemo, or a similar something similar to what chemotherapy does. So that's how I would approach your case. But if you're asking if you can just take cleansing plus alone and avoid surgery, I'm not gonna say yes. I'm not gonna say yes. Okay. Chances are you won't. Chances are you won't. But just to make you realize, if your doctors or if the surgeon thinks the tumor can still be resected, please have it resected, because after surgery, your case, the management of your case will be much simpler, because the main bulk of the tumor is out of your body already. We would just manage the microscopic cancer cells circulating around your body, and it's easier to do so.
This is something that we all have learned from Doc Jansen and Sir Sean, that surgery is not an always open option for everybody. So if it's open for you right now, you might want to take advantage of that one. Okay. All right. Next question coming from Ms. Susana Fernando. Question is, for diabetic patients, is the tablet already okay?
Case to case, like what my patient, what I told you, the tablet was enough for him, no? Tablet plus some other supplement.
Amazing.
I mean, it was enough for him. For my other patients, tablets is not enough. They need the soft gel. Yeah. So I think depends on the person. So how do we know if it works? It will work for you. Go and try.
Yeah, go and try.
Yeah.
In fact, we on when you go to our online purchase, you can or you just ask one of the CSOs. They'll let you know. Tell them whether you are mild, moderate, or serious diabetes. They have guidelines that will guide you. All right. So
Exactly.
and like Dr. Jansen says, if it's not strong enough, then up the strength to the next stronger product in the series, right? So good thing diabetes is not like super time sensitive, right? So even if it's not doesn't reduce your blood sugar back to normal, it will at least halt it, bring it under certain measure of control or improve, but not be able to bring it to normalize yet, unless you up the protocol.
Excellent. Thank you, Dr. Jansen. Thank you, Sir Shyan. Okay, next question coming from Miss Girly Donasco from Shopee. Is PPAR safe also for people with heart issues, like after having angioplasty?
Yes, PPARS is a microalgae. It can help chelate heavy metals from your body. It lowers inflammation because it has a strong anti-inflammatory, antioxidant property, no? One other thing, it helps manage your fatty acid metabolism. So it can help lower cholesterol, triglyceride levels. So I should say it should be one of the mainstay of one of the main supplements that you're taking. But of course, depending on your case, I would probably add something more or at least do chelation on you. Chelation. Yeah. Chelation is basically extracting the heavy metals so you pee them out. The idea is to shrink the plaques in that is accumulating on the walls of your arteries. So that's something on top of my mind that I might do to you if you are my patient. So, but of course, no, for me to make sure the recommendation is correct, schedule a consult.
Exactly. All right. Well,
Mhm.
may I just say for yes,
Yeah,
go ahead,
sorry.
Sir Shyan.
What was the question again?
Procedure. The question is
Oh yeah,
PPAR
wait.
safe
Yeah,
for
yes,
angioplasty? Yeah.
yeah, absolutely. And I just wanted to share. Sorry,
He
there
was
was
excited.
yeah no. Sorry, I was reading something else, right? So I actually had this on my personal patient, personal client of mine. Her name is Tita Tita B. All right, and then she had to go for angioplasty.
Mm-hmm.
Right. So she actually took the liquid one box and then soft gel capsule and tablets after that. And because before that she actually asked her cardiologist whether she could have an additional month to do something, whether her angioplasty was urgent or not, whether she had one more month. And within that 1 month, the angioplasty procedure was not necessary anymore.
Wow.
The surgeon was actually very happy because she told me her surgeon operated on 2 or 3 of her brothers, about 3 to 4 stents each. So the surgeon said he had installed more than 10
That's a lot.
in her family. So he said, I don't need to make this, I don't need to earn your family's money. It would be so nice if I did have to put a stent in you also. So the good news is, yeah, that's the case. So for everyone, it's really, really good for cardiovascular conditions because of management of the inflammations. It also makes the blood vessels more pliable. This you won't see in 3 weeks, right? But if you take the product like the tablets, right, for more than 3 to 6 months, it's been shown to make your arteries more pliable. Okay, and that's really good. And the reason for that is the reduced inflammation and clearing of blockages. Yeah, so that was actually shared with me about the pliability of the blood vessel was actually shared with me by Dr. Jhen. So Dr. Jhen is a WHO fellow. He's the person who hunted down SARS. Literally, he actually found the source, the cat, right? The civet cat in China. So he's an expert in communicable diseases, but he actually was one of the researchers who was taking a look at our PPAR extracts. So he made that comment, and he said that as a researcher, they actually don't believe in natural products, Doc. Doc, I met another researcher, PPAR researcher, as in a synthetic molecule. I actually asked her this, right? don't you believe prevention is better than cure? She actually told me no. She actually told me no. So that's the mindset of pharmaceutical clinical researchers, right? I guess that's how they were geared because they look for synthetic solutions for everything like that. So it's a totally different mindset. By the way, Dr. Jhen also never believed in natural products. But by the time he was sharing this with us, he had completed trial pilot research with us. And he carries a bag of PPAR tablets everywhere he goes in his pocket. So that's a big change. And that was a very good endorsement. Yeah. All right. Okay. Sorry for the distraction. Let's
It's
get back on
okay.
topic.
It's really okay. I mean, I'm so amazed that we are hearing a lot of great stories tonight with angioplasty, even with the saving the foot from amputation. These are things that we usually hear things like benign cysts, benign tumors where surgery were prevented by PPARS, but now there's actually a lot more that it can help. But by the way, I was about to say a while ago, for those of you who wish to have a consult with Doc Jansen, please, the link for you to schedule a consult is in the description box, or you can just type in how to consult. Our PTHCS will definitely get in touch with you individually. All right. So
Doc,
yes.
your patient is greeting you, Doc.
Hello.
Yeah, I saw
Hi
it.
there.
Jati Rabago. She said, "Good evening, Doc Jansen, your patient."
Yeah, yes, yes, I remember her. I
Exactly.
remember her. Hello,
Wow.
hello.
You have a lot of fans, Doc. All right. So next question coming from Miss Minda Banela. Doc, how can PPARS help to osteoporosis or arthritis patients in spine?
Uh the mechanism, no. It won't. With arthritis, it can help lessen the pain, lessen the inflammation. But if you're talking about osteoporosis, it won't. The issue is different. Yeah, the benefit that you get from PPARS is different, no? And the issue with osteoporosis is different. So it won't. With osteoporosis, you need to have denosumab or this medication, teriparatide. You need high amounts of vitamin D3 to absorb the calcium, and vitamin K2 to channel the calcium inside your blood towards the bone. Yeah, that's how you basically approach osteoporosis. And then you have to do exercise. Yeah, because if you don't exercise, your bones will not build itself. You have to use the bone in order for the bone to strengthen itself. Okay, so that's how you approach osteoporosis.
I wanted to add that for the patient who has osteoporosis, I have my experience is patients who do develop osteoporosis, usually their lifestyle has is less than ideal, right? Doc, probably a lot of dairy, very acidic as well. So for those patients, on top of what Doc Jansen said for your osteoporosis, I want to encourage you to take just the PPAR tablets, right, as part of your supplementation program, because you're probably in line for all the other metabolic syndromes. So that is where the PPARS is really gonna help you as well. So anyone with a medical condition that can be treated nutritionally or nutritional mechanisms, it really just highlights that very likely your lifestyle and the food that you eat is not it's not sufficient for maintaining your body. So please start on natural supplementation while it's early, so that you can avoid any other illnesses manifesting as time goes by. Doc, and I came back from Singapore, so I met up with some friends, right? And then I realized something. Oh my God, they look very old. I hope none of them are watching right now. Yeah, Doc, I suddenly realized I really don't look my age. I really didn't know that because I'm always with you, right? I keep thinking I'm 38 years old, Because look at Sheila, look at Jhen, look at yourself. You're all very young. So and then I feel like I'm part of you guys. But when I was with my friends who are also 50, oh my God, their face is like the color is faded and there are wrinkles and the hair is all gray and it's very evident. On the other side, the taxi driver, the Grab driver that I was sitting with in Singapore, when I told him that I'm 50, he was shocked because he thought I was a young man when he picked me up. But when he told me his age, I was shocked. He was 58. He was 58, right? And then he looks like no older than 42, and he says, you know, all my girlfriends, I need to change a girlfriend when they hit 40 because I cannot accept women older than 40. And I was like, oh, his current girlfriend is in her late 20s.
Late 20s, wow.
Yeah, so he looks really young also. And then, he does supplementation. He does a lot of facial regime.
Face,
Yeah. So I just want to share with everybody, you know, as you age, just do take care of yourself. You can actually look like 10 to 20 years younger than your peers if you take care of yourself, all right? So supplementation is definitely one way to start, okay? And of course, make sure you have a good lifestyle and exercise. Yeah. I walk 5 kilometers every day, okay? I go to treadmill at incline at 2, speed at 5.0, and I do that for an hour minimum every day. Yeah.
Excellent. Very encouraging. You know what, sir? Sir and Doc, may I just say I'm very excited, okay, to celebrate my 40th birthday next year. So,
Oh, you also good.
thanks
You
to
look
PPARS,
like
of
in your
course.
early 30s at most, right? Yeah. And it's not the filter we're talking about, right? Some of you
Yes.
are thinking we have a filter on or something. No, it's not the filter. Yeah, but if you meet Doc Jansen in person, he does look like a K-pop star, the way he does on camera right now. All
May I
right.
just say, his patients when he does his consults are on makeup. May I just say that? Okay. Well, thank you, sir. Thank you, Doc Jansen. Next question. There's a follow-up question from the patient who underwent angioplasty. Question: as I'm already taking telmisartan 40, how many PPARS tablets should I take?
I have to see you. It's not because of telmisartan or I have to take a look at your case so I know what to recommend. It's not just simply tablets.
Exactly.
Yeah, but the basic one is of course 20 micro tablets a day, but you might need extracts depending on your case. So the answer is I don't know.
Okay. So go see Dr. Jansen Kalala. Okay.
Yeah.
All right. Thank you, Doc. Okay. Another follow-up question from the person who has who mentioned about osteoporosis or arthritis a while ago. Question is how will PPARS help and which form? Is it the liquid, powder, or tablet?
Help what?
The person who has osteoporosis or arthritis, I think she's asking which form of PPARS would be the best for her.
I have to see you.
Mm-hmm.
Better I have to see you if you really want to try on PPARS. But again, the answer to the question, osteoporosis, how we manage is how I just discussed, no? If you want to use PPARS, then it has to be used with your other health issues, not the osteoporosis or the arthritis. Okay? Yeah, so I have to see you to answer your question.
Okay. All right. Thank you, Dr. Jansen. Sir Sean, would you like to add anything?
No, I'm fine. So a reminder to all our viewers today, right? When Dr. Jansen gives any examples of protocols, please be mindful that we are speaking to a general case and not specifically to your case. That means whatever conditions you let us know, we are saying that a patient with those similar conditions, this is what we would normally recommend. Okay? Do remember for a specific advice, medical advice, it is always important and responsible for both Dr. Jansen and myself that you see us in person or have a proper consult. All right. Asking questions like this and us answering is for your information. It's not a proper consult. Okay. I just want to everybody know that because
Correct.
we are talking about your health. We've got to be responsible. But this information that we share at least will give you some idea what kind of questions you're going to ask during the consult, and we hope that by sharing these information with you, you can decide on a strategy for yourself and then go and consult the appropriate expert before you really start on any protocol. Yeah.
Exactly. Thank you, Doc. Thank you, Sir Fan. All right. An interesting question thrown to us privately by our viewer. All right. Question is, if a woman stays single for the rest of her life, is she 100% free from cervical cancer? Finally, a cervical cancer question tonight.
That's provided
Um,
sexual activity, right?
yeah, cervical cancer is not only acquired from sexual activity. Yeah, it's not through sexual contact alone. Would a virgin, would it possible for a virgin to get cervical cancer as well? Yes. The answer is yes. Okay. Why? The cervix, okay, the cervix, it's where cervical cancer arises, So if there is repeated inflammation at that area, inflamed, repair, inflame, repair, inflame, repair, repeated again and again. Where did the inflammation uh, came from? It can be through a bacterial vaginosis, fungal infection. Okay, so you can still get cervical cancer from those things, especially if your genes, you have a propensity to develop cervical cancer, then you can still get it. Okay, but it is not because of the HPV virus. Okay, so there's still a possibility, although the chances would be very very small. And I should actually start sharing with you this information that I learned from the conference that I attended in Taiwan. Um, cancer, right? There are hallmarks, no? There are 10 hallmarks of cancer. So these 10 hallmarks explains the onset, the progression of cancer, and its recurrence and its metastasis every step of the way of cancer development. Now, these 10 hallmarks, um, they're saying that there is one entity that can explain all the 10 hallmarks. Meaning, the onset of cancer, carcinogenesis, the promotion of cancer, okay? So, cancer cells multiplying, okay? Evading the immune system, and progression of cancer, which is cancer forming lumps, cancer metastasizing. So they're saying there is one entity that explains all this. And they're saying that it is fungal infection. Fungal infection. How did they know that it is fungal infection? Because from the biopsies that they're taking, from the surgery, from the tumors that they were resecting, they were able to see fungal elements inside the cancer cell. Okay? So this is why they were thinking that, hey, it might be because of fungal infection that caused the initiation of cancer, the progression, and metastasis of cancer. So this is something new. We still don't have guidelines on how we can address this. How do we deal with patients? We're practically in the gray here yet, no? So, however, of course, if we're just talking about fungal infection, there are medications that we can use to treat fungal infections. Example would be itraconazole. And the good thing is itraconazole is a antifungal medication that is well studied. The safety profile is well described. So we know how to prescribe it, at least safely. Yeah, safely. But using itraconazole for cancer treatment itself, no, there's still nothing yet. So question here is, would someone like me, knowing this, would someone like me as a doctor, would I prescribe itraconazole for one of my cancer patients? I would. But I would use it within the standard dosing that would be safe for the patient. Okay, but it's something that I would use. Okay, so there is a possibility. Again, going back to the question, no, would a virgin acquire cervical cancer even if she had practically no sexual interaction in her lifetime? The answer is yes. If she has repeated vaginal infections.
So it's always a best to have be vaccinated with cervical vaccine.
Yeah,
regardless.
but the cervical cancer vaccine would only protect you against HPV. It won't
Yeah.
protect you against the bacteria and the fungus. So, hygiene, I guess.
That's true. That's
Yeah.
true. All right. Thank you, Dr. Jansen. Sir Sean? Okay. Next question.
We'll go next
Okay.
question.
Okay. I think this will be our last question actually for tonight, coming from Miss Tessa. Okay. My mother is 85 years old already. She is bedridden due to stroke. Is there a way to manage the side effects of dialysis naturally?
Oh, this is a good question.
It is.
For this particular patient, let me share with you. All right, I'm actually now in talks with the Dialysis Association of Philippines, and these are actually owners of dialysis centers in the Philippines, and many of them are actually nephrologists by profession as well, by medical training as well. So I'm actually in talks with them because we are looking at how to improve the quality of life for patients on dialysis. And this particular nephrologist was looking at all our clinical papers, the science behind it. So he's very excited. I always thought that there might be that the nephrologist would just want to concentrate on dialysis and nothing else, right? And I was surprised that they actually want to look at our protocols because the patients undergoing dialysis need help too. They get very weak, as your mom is experiencing, and they're not able to do well even on dialysis. So the nephrologist knows they want to look for something else on top of the dialysis to help the patient. All right. So we're not talking about getting your mom off dialysis. We're just talking about the quality of life. So I was also sharing with him, we actually have dialysis patients that have been on dialysis for 30 years, 30 plus years. So they are in their 60s now. They were in dialysis in their late 30s. And the person actually eats normally. So he's not on a super restricted diet, which most patients on dialysis have to be on. And he's healthy, he looks normal, exercise, everything, in his 60s already. So apparently he has been on PPAR tablets for more than 20 over years. I myself, because there was a question by your patient, doc, Jacqueline asked, how do I look so young? Am I on PPARS? So Jacqueline, I just want to tell you the answer is yes. I've been eating PPAR tablets non-stop except for a break for 2 years, all right? But in the last, from 27 years old until now, for the last 23 years, out of the last 23 years, for 21 years, I've been taking PPAR tablets every single day. Okay, so it's part of my daily supplementation, and it has a very strong anti-aging effect. All right. Recently, most of the anti-aging mechanisms products are looking at is preserving mitochondrial functions, and that's exactly why we are able to protect your bone marrow from cytotoxicity when it comes to chemotherapy. It preserves mitochondrial functions. So yes, it is anti-aging. And for the dialysis patient question, yeah. Okay. One thing that we do notice from dialysis patients that we do have, it's not uncommon to actually have the number of visits to the dialysis center actually be reduced. All right. So patients on our extracts actually found their a reduction. Extracts and tablet actually found a reduction. Not all. Some actually found a reduction on the number of times they need to go for the dialysis. So it could be a combination of the product plus very more discipline in watching their dietary intakes as well. But for dialysis patients, for maintenance as a supplement to go together with the dialysis so that the patient stays stronger and healthier, then I think a combination of the tablets and at max the soft gel capsule would be more than sufficient. Now, if you really want to see if there is a slim possibility, and this again will vary case to case on why there was a kidney failure in the first place, because we actually have patients who go off dialysis, but that's like my 15 years, I only came across two cases like that. So again, I don't have the fine details because it's not my patient or my client. It's one of our doctors, and they didn't share the what's that called, the the patient data. So those are the options, but definitely for your mom, I would suggest at least micro tablets, 10 micro tablets 2 times a day. Yeah, if all the soft gel capsule, all right. And like Dr. Jansen said before, how would you know it works? Well, the product is absolutely safe. So try, right? Try and see if your mom gets more energetic and more alert, and that's already really fantastic for her age, right? Yeah, for her age. Yeah, Sheila.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. All right. Last question, because this popped up just recently. The question is coming from Mr. Jati Rabago. Question
Yeah,
is,
that's fine.
yeah, but I'd like to read first the comment. You walk your talk, Doc. Sir Sean, thank you for answering his questions also. Now, the question is, can fenbendazole
Yeah.
capsules treat cancer?
Yes, the answer is yes. Fenbendazole, I actually use its counterpart, mebendazole. The reason why I use mebendazole instead of fenbendazole is because of the availability. Very difficult to find fenbendazole. But I know of a compounding pharmacy who, I'm not sure. Yeah, I'm not sure. I'm not sure if they do provide fenbendazole. I'm not sure. Anyway, I use mebendazole personally because mebendazole is more available. And how this anti-parasitic medication, it's an anti-parasitic meds, mebendazole and fenbendazole. Okay. So studies have shown that it can stop the growth of cancer. So it can stop cancer cells from dividing. So how does it do this? The medical term here is it destroys the microtubules. Okay, anyway, when cells divide,
Very,
they have
very,
these
very.
rods. They have these rods. No, when cells divide, normally, no, they have these rods that pull that pull it apart. These are microtubules, so it disrupts the tubules. These I think the more accurate the more accurate comparison would be they're like cables. They're like cables that the cells attach to the thing that they want to separate. So that microtubule, it disrupts those microtubule. So that's how the anti-parasitic medication work. The problem there is absorption. Mebendazole and fenbendazole are not highly absorbable. Okay, so you have to consume it or you have to take it with meals, and a fatty meal at that. Okay, so for you to be able to absorb. Okay, so yeah, but yes, you can use it, but I won't use fenbendazole or mebendazole alone as a treatment for cancer. I use other I use other medication that I repurpose, that I use for off-label purposes for cancer. Okay, so yeah, so that's my take on fenbendazole. Yeah.
All right. Thank you, Doc Jansen. All right. Sorry, this will be the very, very last question for tonight. Okay. All right. Another follow-up question from the person who asked about the managing side effects of dialysis. So which is the best form? Is it the capsule or the powder extract?
Oh, actually, if you're just managing your dialysis, right, I would go for the capsule. Right, number one, the capsule, we remove things like carbohydrate, the macronutrients. So again, less taxing on your on your kidneys, right? So that you have actually, yeah. So it's really just the phytonutrients, the PPARS. But it's not at the level of concentration of the powder. But I believe this will be sufficient for you. And then you can always pair it. You can pair it with the tablets, because the patient that survived on the dialysis for 30 plus years, he was actually just on the tablets. The capsules are something was developed about 10 plus years ago. So he was taking the product before there was ever any soft gel capsules. In the past, there was only the tablets and then the liquid. There is nothing in between. Okay, there's no soft gel capsule, there's no extract powder. Those were developed later as we worked with more doctors, and doctors wanted something which was more like a capsule and had less fluctuations. So we removed the macronutrients that made for more streamlined products that doctors were more they were more familiar with streamlined product and not just a food supplement, right? Yeah, so that's how it is. So I would recommend the soft gel capsule one a day, and then after that the micro tablets 10 micro tablets twice a day, and then observe your mom, right? Make sure that she is well, that nutritionally speaking and in terms of food volume, even when you take 20 grams, 20 micro tablets, 10 micro tablets 2 times a day, you're only taking 4 grams, all right? 4 grams of powdered LJ. So by volume and quantity, that has literally very little impact on your how shall we say, your dietary management, right? It's almost like you're sprinkling algae powder on top of the meal that your mom is taking. But it packs quite a punch nutritionally, and it packs quite a punch when it comes to having the effects of the phytonutrients. The soft gel capsule, of course, is more of just the phytonutrients and the PPAR agonists. Okay, so that's what I would recommend.
All right. Thank you, Sir Sean. Doc Jansen, would you like to add anything?
Nothing. I'm good.
Okay, well, that's actually our last question for tonight. It's such a great way to end our October, okay, because tomorrow is the first day of November. I'd like to ask for a very, very quick parting words from the both of you. Who would like to start first? Doc Jansen?
Yeah, okay. Yeah, thank you everyone for staying with us until this late at night, even though it's October 31.
Yeah.
So happy Halloween to all of you. And I hope you learned a lot with all of these discussions. No? So we're learning a lot in this activity of ours. And I look forward seeing you next month. And hope I'd be able to share more with all of you guys. No, so thank you. I'll give you the floor to Shen.
Yeah, and again, like Dr. Jansen, I thank everybody, and I think the question about the dialysis one, it's pretty timely. It's quite interesting that how everything falls in place. We talk about this, and I'm continuing our talks with the Dialysis Association, and we are actually starting with some of their patients as well. We're making sure that we monitor how we do it. So again, we'll keep you updated. So thank you so much for your time, and do have a good long weekend ahead, right? Tomorrow no work, so it's a long weekend. Enjoy your time with your family and stay safe. Let's all keep Philippines in prayer for the typhoon supposed to have landfall next week. Let's pray that it doesn't, because we just had a difficult one. I don't think we want another one. All right, so thank you everybody. Have a good weekend ahead.
Thank you, Sir Sean. Thank you, Doc Jansen. And on behalf of all the viewers tonight, we would like to say thank you for answering our questions. And we look forward to seeing you both again next week for more questions to be answered. Thank you so much. Now, at this point, I'd like to invite everybody this coming November. That's another Thursday, another 7:30 evening. The title of our webinar is Thyroid Cancer Uncovered: Navigating Diagnosis, Treatment, and Recovery. There you go. And of course, I'm very, very excited to invite everybody this coming November. I would like to call on all our VIP clients, okay? Get ready for our early holiday treat because it's VIP season again. Join the exclusive VIP Meet app. This is happening this coming November 13th. That's a Wednesday at 7:30 p.m. This is going to happen via Zoom. So This is packed with exciting freebies, raffle prizes, and exclusive VIP promos. So please mark your calendars and don't miss this exciting event. Now, please know that your victories over cancer and your metabolic illnesses or other illnesses is what keeps us going here in Simply Nature. Because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Have a good weekend ahead. And God bless you all. Bye.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.